You only have so much time left. Open enrollment for Medicare ends on December the 7th. Medicare certainly can be complicated, which is why today we have two Medicare and insurance experts in, Steve Edmonds from Alliance Insurance Services, Catherine Sevier from AARP. All right, let's first make it very clear, okay, Catherine? Let's talk about who open enrollment for is and why.
So open enrollment is for current Medicare recipients. It's their one chance every year to look at what they're doing and change it if it's not meeting their needs. And we encourage everybody to look because there are a lot of changes that are going on in Medicare this year in particular. So what you want to do is you want to look at your plan and ask a question about, is it meeting my needs? Has my health changed? What medicines do I currently take? And are they covered by the plan I currently have? And if you're at all concerned at that point, this is your chance to change plans for next year.
Yeah, and automatically, if you just said, oh, I'm not going to change anything, I liked what they had last year, that doesn't mean that they're offering the same thing this year, does it?
That's correct.
Okay, so you definitely need to look at it. All right, so Steve, let's talk about this. We have a big change this year. It deals with what's called the donut hole. So let's explain.
Yeah, so for many years, Medicare beneficiaries have been dealing with this thing called the donut hole, and it comes into play basically when your prescription drug cost has reached around $5,000 for the calendar year. And keep in mind, not everybody gets there. I mean, a lot of people are on just a couple of medications. But when this happens, you still have drug coverage, but your copays and your out-of-pocket costs go way up. So in 2025, the federal guidelines have completely eliminated the donut hole. And this should result in much less out-of-pocket costs for the Medicare recipient. And also another thing that the federal guidelines have done is they've lowered the catastrophic limit on the drug coverage down to $2,000. And to put that in perspective, in 2024, that catastrophic limit was like $8,000. So again, this is just a tremendous savings to the Medicare recipient. So, but you do need to be aware of your guidelines and, and see how your Medicare plan's working. As Catherine just mentioned, formularies can change, deductibles can change, copays can change. So it's a really good time to review your plan to make sure you're getting what you need out of that particular plan.
All right, let's go through the different plans just so everybody is kind of on the same page. Catherine, let's talk about A, B, C, and D.
Okay, so Medicare is complicated. Part A is your hospital coverage. So that is where if you come into the hospital and stay overnight, that's what pays for it. Part B is your fee coverage for your doctor visits, your clinic visits, your x-rays, your labs, all of those things that you generally do as an outpatient. Part D is your drug coverage that we were just talking about. Now we're going to back up and talk about what is Part C. Part C is what we call a Medicare Advantage program that wraps all that up together in a network that you can choose to put all of that together and go into that network. You may get some extra benefits from that, like some eye coverage, some dental coverage, some other things with it, silver sneakers sometimes. But you really need to understand where you live and what your particular coverage needs are. And this is the time of the year when you need to do that evaluation.
Okay. All right. We got about 2 minutes left. Steve, I want to make sure we get to this. Let's talk about the difference between Medigap versus Medicare.
Okay. So one of the confusing things for people is you'll hear this term Medigap or Medicare supplement. It's the same product. So it's the exact same product. So that's one thing. But people can have just regular Medicare. It's going to cover about 80%, but most of them choose to go with a Medicare supplement that'll pick up that extra 20% that Medicare didn't pay. But another option is you can go with Medicare Advantage plans. Catherine just talked about Part C, so you can choose to go with those, but they're vastly different coverage. A Medicare supplement versus a Medicare Advantage, two different coverages. and you have to sit down and review those to see which one of those plans will better fit your needs, but they're both good products.
Okay, and before we go, we always have to make sure we get this question in, Catherine. If you're not currently on Medicare, because you're not 65 yet, okay, when do you have to get on Medicare?
So look forward to that 65th birthday and 3 months before to 3 months after. So in that 7-month period, you must sign up for Medicare. If you're still employed, you still must sign up. If you have a credible coverage with your employer, you can defer Part B, but you have to do it actively, or you will pay a penalty of 10% for the rest of your life if you try to go back in and get Medicare Part B later. So you do not want to miss that date, 3 months before to 3 months after, or the month of your birthday. Go online, sign up.
And in case you missed it, even if you already have, you're working for an employer, you have insurance, you must sign up again, otherwise you're going to get charged for the rest of your life. Thank you both for your time and your expertise making a complicated subject very easy to understand. Let's put up the deadline again, because open enrollment is ending for all who already have Medicare. That deadline for open enrollment is December 7th.